Much progress has been made in public health in Abu Dhabi, with many infectious diseases eliminated with clean water, good housing, the eradication of insects, and a comprehensive package of vaccinations. In some ways, Abu Dhabi is a healthy environment. However, our development has been fast, and this has contributed to a rapid rise in chronic diseases, such as cardiovascular disease and cancer. Public health data shows that Abu Dhabi has one of the world's highest rates of risk factors, cardiovascular disease, including diabetes, high cholesterol, and high blood pressure. Left unchecked, these threaten early heart attacks and strokes across the population. In addition, Abu Dhabi has a high rate of death from certain cancers, for example breast, lung and colon, often because people present late or do not take up their screening. The Health Authority Abu Dhabi is driving research into the causes of chronic diseases in our population. These causes will include a mix of genes and environment. However, it is launching a range of high-impact programs to show measurable results fast. The evidence is also clear that too many people die on Abu Dhabi's roads, largely because people drive dangerously, use mobile phones, and don't wear seatbelts or even proper restraint for their children. The Health Authority Abu Dhabi's prime responsibility is ensuring the health of the people of Abu Dhabi. Key pillar of our effort is public health, led by one of the core teams in the Health Authority Abu Dhabi. Through the Public Health Surveillance Team, we collect data on the biggest killers and causes of disease in Abu Dhabi. Then 6 specialist public health delivery teams drive high-impact programs to reduce sickness and early death.
In the Health Authority's role to provide reliable excellence in healthcare, the public health function is one of the largest key areas that we focus on, and the public health team is one of the largest teams that we've got in the Health Authority. The public health team focuses on providing 3 main focuses. The first of which is healthcare prevention, healthcare promotion, and providing surveillance and data and statistics on the types of diseases and the number of people that suffer from each respective disease in the community.
Public health is about identifying the big killers and the big causes of sickness and suffering in our society and doing something about it, whereas individual patient care is about treating the individual. Public health is really about treating the community and the population as a whole. So population health or public health involves epidemiology, which is looking at patterns of sickness in society based on data that we collect. It's making decisions, looking at the evidence base and speaking with experts. And then it's taking actions to do something about the biggest priorities that we find through our epidemiology. The Health Authority has a substantial interest in public health, partly because the Emirate of Abu Dhabi has some very substantial public health issues. In a country which is 37 years old, the community has moved rather quickly from a pattern of developing world public health dominated by infectious diseases to a developed world pattern of public health dominated by chronic diseases such as cardiovascular disease and cancer. Whereas some of the early public health interventions, clean water, good food, shelter, some vaccines and treating infectious diseases were rather simple in terms of methodology. The treatment and prevention of chronic diseases is more complicated. Cancer and cardiovascular disease are largely diseases of lifestyle. They are related to risk factors which begin in attitudes, are manifest in behaviors, and ultimately are seen as obesity, tobacco smoking, and their consequences, which are high blood pressure, high cholesterol, and higher incidences of cancer and cardiovascular disease. So the question for our team is, well, what are the biggest killers and causes of sickness in our society? So those are now cardiovascular disease, cancer and road death. And what can we do about those according to the evidence base? The answer to that question is we need to do a range of different things. We need to educate our community and improve awareness. So for example, of the importance of healthy eating, the importance of regular exercise. We need to pass legislation, for example, banning smoking in public places, looking at the pricing of tobacco products, looking at making fresh fruit and vegetables available to the community. And ultimately, we need to track and monitor our performance against targets that we set ourselves according to the evidence base. The public health is about treating the entire community. It's about identifying the causes of early mortality or death and causes of sickness or morbidity in our population, prioritizing those and finding evidence-based interventions that really will work. Public health is a continuous improvement cycle because early mortality and sickness will never be entirely eliminated, so we try to do a better and better job each day.
The Health Authority Abu Dhabi's public health campaigns have already delivered measurable improvements in the health of the population. The expanded vaccination program includes new and innovative vaccines against a leading cause of pneumonia and meningitis, plus a vaccine preventing cervical cancer. Data shows breast cancer screening is steadily increasing. Wakaya testing has identified people with cardiovascular risk factors who require further investigation and treatment. A total of nearly 60 programs make up the Health Authority Abu Dhabi's response to the challenge of protecting public health in Abu Dhabi.